नमस्ते एवरीबॉडी, दिस इज मी आरजे अर्चू। और आज मेरा बहुत बड़ा सौभाग्य है कि जिस महीने में इस अवेयरनेस की बात चलती है, उसी महीने में हमारे साथ वन ऑफ द मोस्ट लीडिंग प्रोफेशनल्स इन द इंडस्ट्री, जो इसकी अवेयरनेस, जागरूकता एंड ऑफ कोर्स अ लॉट ऑफ सिम्टम्स और सॉल्यूशंस जो हैं इस पर्टिकुलर कंडीशन के, उसके बारे में बात करेंगे। आई हैव विथ मी द वंडरफुल Takida Pharma से Dr. Tribikam Panda ji, and I'm so happy that I'm going to be understanding about the Hodgkin lymphoma because नाम तो बहुत सुना है, लेकिन अवेयरनेस वाइज मुझे ऐसे लगता है कि बहुत सारे लोगों को, चाहे वो आम हो, बहुत एजुकेटेड हो, शायद जानकारी उतनी होगी. So here the awareness, myths and hope, and I'm so happy that I have with me Dr. Panda. Thank you so much for joining me, Dr. Ji.
Thank you so much. Thank you so much for this excellent opportunity for creating this awareness for the much needed disease that is Hodgkin's lymphoma. Thank you so much.
ये नाम आपने इतने आसानी से ले लिया क्योंकि आप इसके एक्सपर्ट हैं, बट हमको तो कहने में भी मुझे ऐसे लगता है थोड़ी हिचकिचाहट आ रही है. व्हाट एग्जैक्टली इज दिस कंडीशन, डॉक्टर?
Yeah. So as far as Hodgkin's lymphoma is concerned, to speak in a simpler way, so it is one of the malignant condition, say cancer of the lymphatic system. Okay. So in our body, actually, there are different type of blood cells. So
जी.
white blood cells are one type of blood cells.
जी.
So it is a malignant condition of the white blood cells, which affects specifically the nodal system, the lymph nodes of the body. Okay. So yes,
माय
this
गॉड,
is the
इमेजिन.
basic.
आजकल बहुत वायरल हो रहा है ये, डॉक्टर आप भी देखते होंगे ऑनलाइन, कि लिम्फेटिक ड्रेनेज कीजिए, यहाँ पे कीजिए, यहाँ पे कीजिए, बहुत सारे पॉइंट्स होते हैं बॉडी के. सो आई एम अज्यूमिंग कि बहुत सारे टॉक्सिन्स जब बॉडी में बढ़ जाते होंगे तब ऐसी कंडीशन आती होगी.
So basically, there are some actually infective conditions like some viral infections like Epstein-Barr virus and other viral infections which can actually predispose to this actually lymphoma like Hodgkin's lymphoma like Epstein-Barr virus or HIV virus sometimes. Okay, but in most of the cases actually we don't find any actually correlations or any causative factors. Okay, so there are some genetic predispositions and lifestyle changes, environmental predisposition, and then infective. All actually they play a significant role. So
इंटरकनेक्टेड
awareness is
है.
the key.
हाउ कॉमन इज दिस कंडीशन इन इंडिया पर्टिकुलरली? कितना कॉमन है यहाँ?
Yeah. So definitely, I can say it is one of the common lymphoma as far as India is concerned. So it is around 10% of all the lymphoma. Okay, that we are seeing in our routine clinical practice, but this figure might be actually underreported because we are actually not able to diagnose actually those cases,
अरे.
and the awareness is also lacking as far as the ground real life practice is concerned among the caregivers, among the patients, among the primary physicians also. So actually the number might be high and we might be actually missing most of the cases, but yes, it is one of the common treatable lymphoma.
क्योंकि द ओनली वे टू फाइंड आउट इज कि अगर आप कुछ सिम्टम्स देखते हैं, जो इस केस में मुझे कभी कभी लगता है पता भी नहीं होता है, जैसे आपने कहा. सो व्हाट इज इट दैट यू थिंक वी शुड लुक आउट फॉर एंड बी सतर्क अबाउट, है ना?
Okay, so coming to the actually the clinical features. So when should we actually suspect you are being maybe affected by Hodgkin's lymphoma? So any patient or any person who have actually unexplained, persistent, progressive swelling anywhere in the body, unexplained swelling, which are specifically maybe firm to hard, non-tender, painless swelling. Okay, then loss of appetite, weight loss, then generalized weakness, fatigability. Okay, then persistent itching or pruritus anywhere in the body. All these are actually the general symptoms of lymphoma, overall all types of lymphoma. But Hodgkin's lymphoma, yes, the most common symptoms are persistent, painless, unexplained swelling, never ignored. Okay,
इज देयर अ
so
पर्टिकुलर प्लेस इन द बॉडी ये स्वेलिंग होती है?
so these swellings can come up around the neck, below the arm fold, and at the inguinal area, abdomen, chest, inside the oral cavity also. So anywhere in the body. So if you are finding actually any unexplained painless swelling, then consult a physician.
Once these symptoms have been seen by a doctor, what is the following procedure thereafter, Dr. Panda?
Okay, so I have also missed one more common clinical features to stress with actually unexplained persistent fever. That is also one type of actually the clinical presentation.
And
Okay,
how long does
so
this fever persist?
so this fever we have seen actually many patients they have been actually diagnosed as a case of Hodgkin's lymphoma presenting with fever for 3 to 6 months.
My
Sometimes ignoring the fever, low grade intermittent fever, loss of appetite, evening rise of temperature with profuse sweating, and on clinical examination, you are finding there are some swelling, as I have already mentioned. So yes,
And
this
then
is
what
also one
what
type of
what
presentation.
procedures do doctors follow thereafter, which
Yeah.
actually once diagnosed they undertake? क्या होता है?
So once we do some clinical suspicion, basically we see the patient and cross-examine the patient. We do some basic actually blood test like CBC, renal function test, liver function test, viral markers and everything. Then the most important thing is imaging, either a whole body PET scan, PET CT or CECT, neck, chest and abdomen. We see actually the area of involvement and simultaneously we do a biopsy of the involved site lymph node and prove the diagnosis. So here actually I want to stress one particular point. In peripheral practice, we have seen actually most of the hospitals, they actually refer patients by doing simply a FNAC testing. So FNAC, fine needle aspiration cytology, is not the diagnostic modality. Always go for excisional biopsy. This is the point actually I want to highlight so that patient can be diagnosed early and can be referred us promptly for prompt treatment.
Did you say exogenal?
Yeah, excisional biopsy.
ये ट्रीटमेंट की जर्नी डॉक्टर साहब कैसे होती है? क्योंकि अक्सर मुझे ऐसे लगता है इन इंडिया स्पेशली वी आर स्केर्ड ऑफ व्हाट इट मे एंटेल एंड हेंस नॉट गो ओनली फॉर चेकअप्स, यू नो. Maybe if you tell us that the treatment journey is not so scary, maybe more people will come because the word cancer is a bit scary.
Yeah. So the word cancer is a little bit scary, but to all the actually common public actually watching this particular discussion, I want to say that Hodgkin's lymphoma is one of the curable malignancy as far as today's era is concerned. So don't worry. We the doctors are here with you. So be faith on us. So as far as Hodgkin's lymphoma is concerned, you have to actually receive some amount of chemotherapy. So earlier it was the era of chemotherapy, but now actually we have targeted immunotherapies available. So with immunotherapy, the adverse effect of toxicities are very much less with prompt supportive treatment and everything. So yes, we have those modalities of treatment at present with hand. Even if the disease comes back, that is with relapse or refractory disease, we can control the disease.
अरे
Okay, so it is actually one of the curable malignancy, I can say. So don't worry.
नाइस नाइस. क्या डिफरेंस होता है इफ यू अर्ली डिटेक्टेड? बिकॉज टिपिकली कैंसर के साथ स्टेजेस जो कनेक्टेड होती हैं, तो लोग कहते हैं जल्दी आ जाते तो बेटर होता. क्या ये इसमें भी ऐसा कनेक्ट है?
Yeah, yeah. So this is one of the true dictum of actually as far as any cancer is concerned. So
Yeah.
the earliest you diagnose, the better the outcome and prognosis is. So in Hodgkin's lymphoma, yes, if there is limited stage involvement, you are diagnosed early, then yes, your fitness is good, your quality of life will be also good, the chemotherapy toxicity will be good, the treatment will also be less intensive, less number of treatment cycles will be also required for the treatment. So better to go as early as possible for diagnosis and management.
Typically, in our country, whenever we know of a particular condition or disease, there's lots of myths that surround it. I know this is a lesser known one, but I'm sure you must be facing them because the more patients you see, the more you realize the kind of myths that exist around Hodgkin lymphoma. What are those myths?
So basically, there are many myths. So number one is I would advocate all my actually patients don't go through Google. Okay, so always consult a trained trained physician. Okay, who has actually received the expertise in that particular field. So in
Correct.
Hodgkin's lymphoma, a untrained expert hematologist. Okay, so it can be misguided by social media. Okay, then actually there are some belief that yes, any swelling in the body that can be actually cancer. But yes, any swelling in the body is not cancer. So get examined by the doctor, go for a biopsy, and be assured. Okay. Then there are some actually believe that Hodgkin's lymphoma cannot be actually affecting the younger population. It is a disease of elderly. But yes, we have seen actually teenagers, toddlers, and even if adolescents and young adults, they are also being affected by this particular disease. So don't be in a premeditated mindset. So always go to the doctors, cross-examine yourself, and yes, and get complete assurance from your treating physician.
After treatment, what is the life like? You must have experienced families cope with this even at an emotional level, because बहुत लोग कहते हैं diseases sometimes can relapse because of psychosomatic, because you're so traumatized by the experience that you might be even inviting it again. तो क्या लिम्फोमा में भी ये हॉजकिन लिम्फोमा में भी ये एक particular journey है जिसका आप बहुत ध्यान रखते हैं?
Exactly. So, as far as the treatment is concerned, it is not only the responsibility of the doctor. So, there is role of actually friends, the family members, then patient support groups, the counselors. Okay. Then comes the role of doctors and the nursing staffs. Okay. So, we give only the medications, but most of the time the patient spends time with their caregivers and friends and everything. So, we have seen many patients actually they have received treatment and now actually pursuing their career. Okay, so we have done the survivors meet also. We actually counseled one patient of Hodgkin's lymphoma with a case of Hodgkin's lymphoma who has already received treatment and is currently now pursuing their study, job, and enjoying their hobbies and everything. Crosstalk. This type of crosstalk can actually bring confidence with the patient. So don't worry. So we are there for you. Okay.
So normal life is absolutely an absolute
Yeah, yeah, yeah,
you.
yeah. Many of our patients actually they are pursuing their studies abroad and doing wonderful jobs. Okay, with Hodgkin's
Uh,
lymphoma, I can say actually there are few patients of Hodgkin's lymphoma whose disease was actually completely chemorefractory. But with the advent of immunotherapy, we have given immunotherapy. They received timely actually autologous bone marrow transplantations, and after that, yes, they are completely free of the disease. Since last actually 5 to 10 years, I can say many patients. So yes, the
that's
future is bright. The future is bright. Just you need to actually come to us in a timely manner.
डॉक्टर पांडा, अगर एक मैसेज देना चाहते हैं आप, क्योंकि इसका अवेयरनेस मंथ चल रहा है, एंड आई एम श्योर अ लॉट ऑफ पीपल विल नॉट जस्ट फाइंड रीअश्योरेंस इन योर वर्ड्स बट विल टेक बैक समथिंग दैट मे बी दे आर मिसिंग फ्रॉम दिस एंटायर डिस्कशन, वो क्या है वो आपका मैसेज?
Yeah. So my message will be actually any case of unexplained prolonged fever,
जी.
unexplained persistent painless swelling,
या.
loss of appetite, weight loss, fatigue or weakness, never ignore.
या.
Get examined by a trained hematologist as soon as possible. Okay. So we'll give you the 100% assurance. No need to panic. We are with you. So early diagnosis is the key to success. Thank you.
कीप योर सेल्स अंडर चेक, एंड जैसे डॉक्टर जी ने कहा कि लाइफस्टाइल का अच्छा होना ये किसी भी डिजीज के लिए लाजमी है और लागू है, बट फॉर दिस इवन मोर सो, बिकॉज वी आर अवेयर ऑफ द इम्पैक्ट ऑफ समटाइम्स doing physical activities, living a balanced life, having a good meal, and of course being positive even in your mind to keep
Yeah,
these
yeah, yeah,
diseases at bay.
yeah.
I really, really thank Takeda Biopharmaceuticals, and I thank you, Dr. Tribikam Panda ji. आपने
Thank you so
बहुत
much.
अच्छे से बातें की, and I like the intent behind your talks, that people have to be
Thank you.
self-aware and they cannot take things lightly. And thank you for giving us hope while you speak of this condition.
Thank you. My pleasure.